Knock.
Come in.
Good morning.
Good morning.
Hand hygiene, patient privacy. My name is Jamaya. I'll be the nurse for today. Can you verify your name and date of birth and let me see your armband?
Audrey Curry, June 27, 1975.
Alrighty. I'm gonna verify some orders really quick. I verified my orders and the doctor has put in for me to complete a head to toe assessment on you, okay? Is that okay with you?
It's fine.
Alright. First, I want to start by asking you some questions. Do you know where you are?
I do.
Can you tell me where you are?
I'm at the doctor's office.
Alright. Do you know why you at the doctor's office?
For physical.
And do you know who the current president
I
is?
do. Trump.
Okay. Can you state your name and date of birth again?
Audrey Curry, June 27,
Alright.
1975.
So my patient is alert and oriented times 4 to person, place, thing, and situation. Okay, so I'm going to start by assessing your head. And I'm going to assess your head for lesions and abrasions and make sure the head is symmetrical. And it is symmetrical and I don't have no signs of lesions or abrasions. Next, I'm going to assess your skin. Have you been having trouble with itching lately
No.
or flaking in the skin?
No.
Okay. The skin is warm to touch and the color is appropriate for the ethnicity of the patient. Next we're going to assess your ears. Have you been having any problems with hearing?
No.
No? Okay, so I'm going to stand within my arm's reach of you and I want you to repeat after me.
Okay. Red. Black. Blue.
Alrighty, so you completed my whisper test, which means that your hearing is intact. Next, I will assess your eyes, but I don't have a pen light. So I will just tell you what I would do. So I would check for perla, and perla is when your pupils are round, equal, reactive to light and accommodation. Alright, next we're going to assess your nose. Have you been having any drainage or anything?
No.
No? Okay, so can you put your finger over one nostril? Can you sniff for me? Can you do the other one? Alrighty. So there's no obstructions in your nose is patency on both sides. And have you been having problems with swallowing or is it painful to swallow?
No.
No? Could you open up your mouth so I can assess the mouth? Alrighty. And your oral mucosa is moist and the color is pink, which is where it should be. I want to put my hand on your neck and assess your neck. Could you swallow for me? Any painful with swallowing?
No.
Okay, could you turn your head that way for me? And I'm assessing for jugular vein distension. And there are no signs of jugular vein distension. And now I want to assess your cardiac assessment. Have you been having any heart issues?
No.
No? Okay. And I'm going to listen with my diaphragm, starting with your aortic area, okay? And this will be on the bare skin, but for confidentiality purposes, we won't be taking your clothes off. And this is the aortic, the pulmonary, the Erb's point, the tricuspid, and your mitral valve. And this is where your apical pulse is, and I will be able to hear your S1 and S2. Okay, and while we're on your chest, I want to assess for your respiratory. Have you been having trouble with breathing or having a cough?
No.
You just say yes to the cough. Say yes to the cough.
Yes.
Okay, and have you been coughing up anything?
It's clear.
Clear? Okay, is it like mucus or how thick is it?
It's like phlegm.
Okay, alright. How long has this been going on?
About 3 days.
Okay. Alright, so now I'm going to assess your respiratory with my diaphragm as well. I just listen to your lobes of the lung and see how you're breathing, okay? Starting with your right upper lobe, your left upper lobe, your left lower lobe, your right middle lobe, and I'm going to assess your 2 lateral lobes, which is your left lower lobe and your right lower lobe. Alrighty. And I'm going to assess your capillary field on both of your hands. And it should be less than 1 to 2 seconds, which it is bilaterally. And while we're here, I'm going to go ahead and check for edema. No signs of edema bilaterally. And while we're here, and I still have my stethoscope, I'm going to go ahead and assess your bowel sounds, okay? Starting with your right lower quadrant. And I'll be doing this with the diaphragm as well. Your left upper quadrant. No, I'm sorry, your right upper quadrant. Your left upper quadrant. And your right lower quadrant. And then I will assess your, okay. And next I'll be assessing your vascular signs with my bell. I'm just turning my stethoscope. And I'll be listening to your vascular signs, which is your aortic, your renal, and your iliac. Starting with your aortic. Your renal on your left side. Your renal on your right side. Your iliac on your left side. And your iliac on your right side. Alright. And could you hold up for me so I can go ahead and assess your back for your respiratory? Starting with your left upper lobe. Your right upper lobe. Right lower lobe. And your left lower lobe. Alright, so we're done with my stethoscope. I'm gonna put it to the side, okay? Okay, and next we're going to palpate your bowel signs, starting with the same area that I started in the last time when I assisted. And I'm going to start in my right lower quadrant. Can you hold your arm up for me? Just going to palpate lightly, and can you let me know if it hurts? Right upper quadrant, left upper quadrant, and left lower quadrant. And can you tell me what was your last bowel movement?
Yes, she like.
Can you tell me what was it like? Normal, okay. What was the color like?
Brown.
Brown. Okay, and do you have any painfulness when you urinate or burning?
No.
No? Okay. So next we're going to assess your legs. I'm going to do 2 of your legs on your leg, your joints on your leg. Have you been having any pain with joints or movement or anything?
No.
No? Okay. First I'm going to assess your pulses in your foot. And your dorsalis pedis on your left is rated at about a 2, which is normal. And your posterior tibia is rated at a 2 as well on the left. And your dorsalis pedis is at a 2 on your right. And your posterior tibia is a 2 on your right as well. Next, we want to hold your joints, and I want you to dorsiflex and hyperextend for me, okay? Starting with your right. Can you flex for me? Can you extend? Can you do it against me like you're pressing the gas pedal? Alrighty. No signs of crepitus in your right foot. Can you flex? Extend? Go against? And do it again. Alrighty. No signs of crepitus in your left foot. And I'm going to check and make sure you don't have edema. No signs of edema in your left leg. And no signs of edema in your right leg. Next, we're going to do your knee, okay? Can you extend? We'll try to extend. Can you flex? Alright. No signs of a crepitus in your left knee. Extend. Flex. No signs of crepitus in your right knee. Now I want to do your upper extremities, okay? And I'm going to, you move your watch for me. I'm going to hold your wrist, and I want you to flex, extend, go against. Alright, no signs of crepitus in your left wrist. Flex, extend. No signs of crepitus in your right wrist. And I'm going to hold your elbow. Extend. I'm sorry, flex, extend. Okay, flex, extend. No signs of crepitus in your right elbow. Flex, extend, flex, extend, no signs of crepiness in your left elbow. Alrighty. And next we're gonna do your gait and balance. I'm just gonna check and make sure you're walking straight, and I'm gonna check your balance, okay? Can you stand up for me?
Kind of fat.
Mom. Okay. I want you to look at me, then close your eyes. Okay, now I'm going to assess your gait, okay? Can you just walk towards me? Alright, can you turn around and go back for me? And I want you to walk back towards me and put one foot in front of the other and look straight ahead for me. Alrighty, go back around for me. Okay, and your gait is intact as well. Okay, you can have a seat for me. And I did forget one thing. I forgot the skin turret. That's going to tell me if you have dehydration or not. And I'm just pinch the skin just a little bit. It's not going to be hard. Just pinch the skin. Alright, no signs of dehydration. Okay, now I want to provide you with a little bit of education. So I'm going to tell you about the Brady scale. And my Brady scale that determines if you are susceptible to pressure injuries, which you're not because you have normal nutrition and you are mobile and there's no friction and shear, so we don't have to move you around in the bed because you're not bed bound. Next, I want to educate you on the Glasgow-Coma scale, and that's for neuro problems like neuro deficits. Like you don't have neuro issues because you're learning oriented ×4. You don't have any head injuries, no falls or nothing. And then I want to tell you about turn, cough, and deep breathe. That's for your respiratory. Every 2 hours, you should be turning, coughing, and deep breathing so it'll help move. Next, I want to tell you about turn, cough, and deep breathe. That's to help expand your lungs so you won't be at risk for pneumonia. So you turn every 2 hours, cough, and deep breathe. The same with the extensor spirometer. You would inhale, hold it, and then let it out 10 times an hour to prevent pneumonia as well, okay? And is that all? I think that's it. Do you have any questions for me?
No.
Okay, well, here are your belongings and your call line. If you do think of anything that you need, just press the call bell and I'll be sure to come back, okay? And hygiene.